Have you read Evaluation of Squint? Tell me the headings under which you will write your answer. Still confused? Welcome to my channel Ophthal Exams and Viva, and today I am going to give you a small framework to write your answer under Evaluation of Squint. After going through my video, you will not only able to write your theory question, be it long answer question or short note, your Viva, and you will have no problem in assessing a case of squint in your practicals. So let's start. Before that, please watch my video till the end, because in the end I'm going to give you a very funny way to remember the flow chart, and it's a, please don't make fun of me after listening to that. ठीक है, you can make your own mnemonics if you want, but just ऐसे ही बना दिया, but हंसना मत, हाँ please. ठीक है, so let's start. This is not just theory, this is everything in Squint which you cannot miss. So let's start. So I'm going to tell you one by one what does this flowchart means and how to remember this flowchart without putting extra effort. So we are going to study smart here, not only hard. Now when examiner gives you a patient on squint, right, how do you start? Or even in exams, the theory question asks like that: imagine a patient of 5 years old, he presents to you with symptoms so and so or squint, and how do you evaluate it and how you go about the treatment. What do? You don't panic, you just run through this flowchart in your head, which I'm going to tell you and explain. Be it any case, forget about squint, you always starts with history. So here also you will take normal history of the patient. You will ask for the age, for sex, for onset of the issue, then onset, progression and duration. You know about all these symptoms, etc, etc, etc. But what is specific to squint, that is important to mention. Most important part is that you mention about the birth history, right? Then developmental history is important. Old photos will also help in evaluation of history of squint, especially in children, because parents are not able to actually tell you what is wrong and बच्चा तो बोल भी नहीं सकता. So this is the best way that you compare or you see or you ask for the videos from the patient to understand the actual problem they are telling you. So you can mention a lot of things about history, because that will tell you that is it congenital or acquired, is it intermittent or constant, is it phoria or tropia. So many things will be clear by your history only. So history is the very important part, right? And the three important things which you cannot miss in the history of while evaluating squint is birth history, developmental history and old photos. Next we come to vision, because without vision there is no squint diagnosis. So it is very important that you are aware of the milestones, that at what age which part of visual acuity is attained, and age wise visual acuity test, because in exams the question will come like there was a 3-month-old child of squint or a 5-year-old child or adult, right? And while evaluating squint you are going to answer visual acuity also in your answer. So you should be aware of age wise visual acuity test. So this is a very important part here. So this will be discussing subsequently, right? Next, examination of squint, we are going to divide it into fixation, motor status, sensory status, torsion and test for binocular single vision. So let's see one by one, right? So what is fixation? So fixation is like what? It's inside the name only, that you need to fix. Fix means steadily looking and maintaining the gaze on a target, right? So this CSM is a grading system which is used in pediatric squint cases. So you remember it as CSM. So C is stands for central, S is steady and M is maintained. What does C mean? Central means the image is falling on the fovea. It's a central this thing. Steady, so eye is holding fixation without having any nystagmus or without moving, and maintained, that it is fixing for a long time So when the fixing eye is covered, the other eye takes fixation, and when the cover is removed, the normal eye still continues to fixate. If both eyes have CSM, then both eyes are having equal vision, and any one of the factor is missing, then any one of the eye is having low vision, poor vision, or we can say amblyopia, right? When you know that eye is fixing, now you go on to check motor status and sensory status. In squint evaluation, it is always advisable to do sensory status first and then go for motor status. Why? Because while checking for motor status, you will be doing certain dissociative tests, and this dissociation may affect examination of sensory. For sensory test first, but we'll be discussing motor test here first. So what are the things come under motor status? That you look for head posture, right? Head posture. Now there are three types of posture. Now face turn. Now if this is a face, right? So face turn means या तो इधर turn हो गया या इधर turn हो गया, right? So ये कब होगा? जब horizontal pelvis होंगी. So either going to right or left. Head turn. Head turn means या तो हेड ऐसे टर्न हो गया इस तरफ या फिर इस तरफ टर्न हो गया, हेड टर्न. ये किस में होगा? ओब्लिक पेल्सिस में. देन चिन अप एंड डाउन. चिन अप और चिन डाउन कब होगी? जब वर्टिकल पेल्सिस होगी. सो जब भी हेड पोस्चर आएगा यू हैव टू थिंक ऑफ पेल्सिस. You think of muscle pelvis. So this is important, especially in paralytic squint. In other squints, this head posture would be normal. Now eye will be deviating to one side. Like this is nose. So where will this eye deviate? Either it will go inside, that is ESO. It will go outside, right? X out, which is exo, hyper or hypo. Right, these type of deviation can be there. There is torsion deviation also, which we will discuss in the next part. So remember about simple horizontal and vertical squints. So ocular deviation. So under motor status you will check for head posture and you will look for ocular deviation. So ocular deviation will tell you, or motor status will tell you where the eye is, right? Where the eye is. Now it is important to check for this deviation in all the 9 gazes. So you have to examine the patient in all the 9 gazes. Why all the gazes? When you know it, to just look for overaction or underaction or any AV pattern. Just in 9 gazes, right? Now how do you to measure ocular deviation? We have objective test and subjective test. Now start your evaluation to measure the angle, right? Now objective test, these tests are non-negotiables. You are supposed to know each of these tests, what are these tests and how to do it in a patient of squint. So here we are just going to remember names. In my subsequent videos we will be discussing each and every point. Objective test, you remember, cover test, you're going to cover one eye, right, and see the other eye. Then uncover eye. Then torch की help से you will go for corneal reflex test, Hirschberg test, Krimsky test and Bruckner reflex test. Then ये आपने टॉर्च की हेल्प से कर लिए टेस्ट, ये आपने ऑक्लूडर यूज कर लिया, and then prisms, and then nothing is working, you go for a machine like synapto 4. So you divide it this way, that first you are trying to use occluders and you are then trying to identify on the basis of torch corneal reflex test plus prism test and then prism bar cover test. Now this prism bar cover test is of two types, simultaneous PBCT and alternate BPCT, and then you finally go for some machine test synapto 4. Okay, I know it looks little difficult to remember, but believe me, wait till the end because I am give you a very good mnemonic to remember all this in just one go. कोई नहीं, we'll do it, don't worry. By the end of this video, you are not going to regret seeing this flowchart. Trust me. So have patience. Let's go ahead. Right? So after covering the objective test, we are now going on to the subjective test. Now, subjective test is what? The subject. Now, these mainly depend on the subject response. Subject response means it is patient response only. So we divided into diplopia test. There are 4 diplopia tests. I think we should put after image test as second, third, and fourth, right? So you remember the subjective test as dash, right? So diplopia test, mainly there are 4 tests which are based on diplopic principle. So these are, now how will you remember these tests? You remember it as 4 worthy boys are mad. Now what is 4? 4 is 4 prism base out test. Worthy is worth 4 dot test. B is Begolini's striated glasses test. Mad is Maddox test, or whatever you find your own way to remember it. If you think this is difficult, so you remember diplopia, alter image, hair screen, and synaptophore. And obviously, then you put the patient on machine synaptophore. First, you are going to do the test, then machines are going to do the test. So hair screen and synaptophore are 2 machines. These subjective tests are nothing but these are sensory tests. So mainly, though you should put the subjective test under sensory status. Okay. Now we come to torsional. So the squint can be horizontal and vertical. So we have done these tests. For torsional or cyclorotation, you go for diplopia charting, double Maddox dot test to test, look for torsion, and then synaptophore, and sometimes with the help of fundus photography also we can rule out torsional squint. And then comes the final binocular single vision. So finally we check the brain. So after all tests for eyes, now we have to check the brain also for these 3 grades. Binocular single vision is 3 grades. So this is simultaneous perception, fusion, and stereopsis, right? And then fusion is what? It aligns the eyes, and then stereopsis gives the depth to an image. So for simultaneous perception there is only one thing, which is synaptophore, जिस पे आप check कर सकते हैं. For fusion, so how will you go for fusion check? So you go for synaptophore. वो तो आप synaptophore से तो आप सब कुछ कर सकते हो. So just mention synaptophore wherever possible. Okay. So fusion may you go for sensory test like fusion, and for stereopsis, for depth perception test, you have separate test for near and distant. So in distant you just need to know the names, nobody is going to ask you. But for near stereopsis, this is very important that you should know about each and everything. And again the synaptophore is here. See, जहाँ समझ आता है उसको डाल दो. And then other tests are titmus, you remember as 3 T's. So titmus fly test, TNO test, 2 pencil tests. So these are 3 T's. Then random dot E test, length test, and Frisbee test. For now, you just remember this flowchart and the tables. In my subsequent videos, we will be discussing each and everything. But before I discuss any test, you should know where to place that test. So if suppose I am talking about titmus fly test, so you should know that it's a test for stereopsis and done for binocular single vision check. So let's go again. So how do you evaluate this squint case? So always first is detailed history, then you go for visual acuity, and then you evaluate for squint. Squint के लिए भी first you check for fixation, CSM, motor status by seeing the head posture, face turn. Face turn is like, suppose this is face, so face turn is या तो right में गया या left में, right? Head tilt, हेड टिल्ट इज या तो इधर टर्न हो गया या इधर टर्न हो गया, राइट. चिन अप मीन या तो चिन अप होगी या चिन डाउन होगी. देन फॉर ऑक्यूलर डेविएशन there are certain objective tests to measure it. So it is cover uncover. टॉर्च से करेंगे तो कॉर्नियल रिफ्लेक्स टेस्ट, हर्शबर्ग्स टेस्ट, एंड देन प्रिज्म्स का रोल आ जाएगा. सो क्रिम्स्कीज टेस्ट, BRT, PBCT, and then comes the machine, synaptophore. Then sensory tests are mostly the subjective test, right? That is diplopia, after image, synaptophore or Hesch screen. Under diplopia, you remember these boys, mad boys, worthy mad boys, 4 worthy mad boys. So remember all these tests. For torsion, synaptophore तो हर जगह घुसा दो, ठीक है. डिप्लोपिया चार्टिंग करनी ही पड़ेगी, तो यू रिमेंबर डबल मेडॉक्स रॉड एंड फंडस फोटोग्राफी टेस्ट. देन फॉर बाइनोकुलर सिंगल विजन या 3 grades, साइमल्टेनियस परसेप्शन, फ्यूजन एंड स्टीरियोप्सिस. दोनों में साइनेप्टोफोर तो आ ही जाएगा. फ्यूजन के लिए वी हैव दी सेंसरी टेस्ट, है ना. देन स्टीरियोप्सिस के लिए नियर एंड डिस्टेंस. सो फॉर नियर यू रिमेंबर साइनेप्टोफोर तो आ ही गया. 3 T's मैंने बताए, टिटमस फ्लाई टेस्ट, TNO टेस्ट, 2 पेंसिल टेस्ट, एंड देन ये 3 टेस्ट भी आपने याद रखने हैं, ठीक है. थोड़ा तो याद कर लो. रैंडम डॉट ई टेस्ट, लैंग टेस्ट एंड फ्रिस्बी टेस्ट. फॉर डिस्टेंस यू जस्ट रिमेंबर द नेम्स, nobody is going to ask you, right? Let's see what are the questions, right? So for written exams, now this itself is a long answer question in theory. Again, another long answer question is this: how do you go for visual acuity checkup in children? Now third important question is, how do you measure the deviation in squint cases? This can come as a separate note as short note. Other are, what are the subjective tests, diplopia test especially, so this can come as short note. And test for binocular single vision, it comes as a separate long answer question. So this is very important, and this is one of the most important Viva question also, that what are the 3 grades and how do you measure it. Another Viva questions are these tests, objective test and subjective test. Another question is, what is CSM? Okay. So just while teaching you all this, I have come up with a very funny way to remember it. Please don't laugh at me, okay, after listening to it. Just यार पढ़ाते पढ़ाते आ जाता है, ऐसे ही याद होता है ना. So especially married couples, they will be able to connect with my this theory. So I'm going to revise it like this. Now listen carefully. It's like angry wife and husband having squint. Like one day, an angry wife catches her husband staring strangely like a squinted eye. Now, so she starts what? Interrogation, obviously. So wife asks a lot of questions. Since when you are staring like this? How is the progression? What is the duration? Are you seeing double? Any trauma? Like so many questions. Then she pulls him close to look into his eyes. So you go for visual acuity. Then she is angry. So she's just fixing her eyes, staring steadily and looking, maintaining her gaze. So she is fixing her eyes on her husband without moving here and there, very central, steady, and she's maintaining the gaze. Now this husband, he senses that something is wrong, right? So go for sensory status. So he starts acting physically. He go for change in head posture. Sometimes he's doing face turn, head tilt, chin up and down, and he's looking here and there, ocular deviation, right? To escape by these tests. So he turns by 180-degree to other side and just leave the space to save his marriage. So angry wife starting history, asking for looking into his eyes for vision, fixing her eyes in anger. Now husband senses his sensory status, acting posture, deviating his eyes, turning by 180-degree and leaving the place in single vision and saving his marriage. यार ये मैंने ऐसे ही पढ़ा दिया, तुम देख लेना थोड़ा थोड़ा, है ना, ये मेरे माइंड में ऐसे ही आया. I think this is very a jokeful way to learn evaluation of squint, right? So beautifully we have covered it and good to go. And wow, beautifully we have done it. So if you are preparing for MS DNB ophthalmology exam, this channel is for you. So wait for my next video, visual acuity assessment test and test for binocular single vision. And please keep that angry wife and husband story to yourself. तब तक के लिए Ophthal.